Hi everyone, this is ABC's of Anesthesia. My name is Lahiru.
And my name's Kaz.
And today we're going to go through something that I get asked a lot about, which is what is the anesthesia training program like? And, how do I get onto anesthetic training? And so I thought what we'd do is just kind of outline, first of all, in this episode, what the ANZCA pathway is, what's the applications like, what's the training like? And then in subsequent episodes, we'd go through all the other stuff like, cover letters, references, interview practice, and all that. So try to do all the stuff around applying for jobs and what the job is like. Now, just to rehash, the ANZCA pathway, it's 2 years of general hospital training. So that's after you get your medical degree, you do 2 years of general hospital training. And this can be up to 12 months of anesthesia ICU, but mostly grounding in general medicine. So, you don't really want to have someone doing too much anesthetics because really what they're looking for is someone who can do, all of medicine. It's got a bit of a grounding in everything.
Yeah.
And then after that, most people would do a crit care year.
Yeah.
Now, Kaz, I think you've got a bit more recent experience of this. The critical care year, what is it like? I think, is it just a Victoria-centric thing?
So I guess critical care year is generally a PGY3 plus year. It's considered a SRMO year, so senior resident role. I don't think it's a Victoria specific thing. I think it's present nationally, but I think in Victoria there is quite a strong emphasis on completing a critical care year prior to being competitive for applying for ANZCA.
Yeah, okay.
And essentially what this year is, it varies depending on the hospital, but broadly you have rotations in anesthesia, in intensive care and in emergency medicine. And depending on the hospital, you can have additional rotations that may include kind of cardiology, general medicine, and have varying amounts of time in the critical care specialties themselves.
Yeah, and I remember when I was going through different hospitals, we almost chose the hospital based on how much anesthesia time they had, because sometimes you could call it a crit care year and it would have very little anesthetics, maybe 6 weeks, maybe 3 months.
Exactly, yeah.
Whereas I think the crit care years are really anesthetically bent, 6 to 9 months of anesthesia and a bit of ICU. And I guess you're not doing things like trauma and nights and relieving.
Yes.
Because it's obviously a very sought after position. I think for my job, there's probably 200 or 300 applicants for these 4 positions. So it's always a really competitive job.
Yeah.
So then, so you do your crit care year generally, so that's as a PGY3, and then you apply for the anesthetic training program. So that's really just an application form, CV, cover letter, 3 referees, and then you're shortlisted for an interview. And then you get on to 5 years of training. Now, because you're in the midst of that training, I thought, why don't we go through what training is like what it involves?
Yeah. So this is actually a very common interview question as well.
Oh, good. Okay, we'll cover that.
So the training for the ANZCA program is broadly broken up into basic training, advanced training, and a provisional fellowship year. So in basic training, you have year 1 and year 2, and in any time in that in those 2 years, you sit a primary exam, which is a basic sciences exam that is a hurdle to progressing into advanced training. Subsequent to that, you have advanced training, at the end of which you sit a fellowship exam, which again you can sit at any point in your 3rd or 4th year. And that again is a hurdle to progressing into your provisional fellow job. And the provisional fellow positions are generally a pre-consultant year, and then they can be general, or often they can be in subspecialty areas that may be of interest to you.
Yeah, good. So it's 5 years of training. You've got your 2 years of basic, and you've got to pass, I guess, your volume of practice requirements and the workplace-based assessments. Then you pass your exam, get your volume of practice and your WBA sorted. Then you move on to advanced training. In that point, you can do your fellowship exam or your final ANZCA exam, which is, you can also do it in your fellowship year, but I think most people try to get it out of the way more kind of quicker than that. And then you've got to, again, do your volume of practice requirements and your final exam, and you do your fellowship time.
Yes.
Okay, good. So, I mean, what's it like in terms of? I remember my training years. It just felt like it's just a lot of work. You're really immersed in anesthesia. So tell us the day. Like, how many hours a week are we doing? How many?
I haven't sat down and counted actually. I think it again varies depending on the hospital and depending on which year you are. But generally, a registrar contract is, I think, 84-hour fortnight, or 86. 86, yeah.
Yeah, that's right. So I think you're required to do 86, that's on contract, but often you'll do overtime for that.
Exactly, yeah. So it's not unusual to do in upwards of 90, and in a really bad week, kind of close to 100, but that's rare.
You mean a good week? That's the extra training.
Yeah, exactly. That's the immersion, I think.
Yeah, that's right.
So your experience can be broken up into, I guess, clinical anesthesia, which I guess is a very core part of your training, and also pain medicine, which again I think is a big component of what you do as a trainee, and also pre-admission clinic, which again you do a fair bit of, and obstetrics cover, which again I guess is still clinical anesthesia, but you kind of provide a epidural service and do a lot of obstetric theatre cover, which in some hospitals form a predominant part of your training.
Yeah, and in some training schemes, you do a whole year of that. So we in Victoria, we have the OPATS year, obstetric peds anesthetic training year. And that way you're essentially, it gives you time to go to the major hospitals. Let's say you weren't at a hospital with obstetrics or peds, they kind of allocate you to these hospitals so you get your peds and obstetric time, which is really, really fascinating, really interesting time. But again, I always remember my obstetric time because it was a lot of really, really busy night shifts.
Yes.
So what do they say? If you're doing trauma or if you're doing obstetrics, that's when you get calls at all hours of the morning.
Yes. Yeah. I have very fond memories of doing many epidurals on a night shift, and fond in retrospect.
That's right. But it is satisfying though when you're called. You're asleep. Let's say it's 3 a.m. Every part of you wants to be asleep at that time. But you get up, you put the epidural in, and generally this patient is really happy that you arrived.
Yeah.
Obviously, you most of the time get rid of the pain.
Yeah.
So it is really satisfying. But yeah, those years were tough.
It's actually one of the most I think rewarding parts of being a trainee, because often you do as a junior trainee kind of lots of urology or scopes where I think you aren't having as much of an active part in the patient's care. I guess you're keeping them safe and anesthetizing them. But with obstetrics, we probably spend a lot more time with patients in terms of putting the epidurals in and doing Caesars. We're the ones who end up chatting to them for an hour and a half, depending on...
and you're it as well.
Yeah.
Often you're on cover, and often most operating happens overnight. It's in some hospitals, it would seem. That's definitely tough. Now, interesting, when I went through, so when I was a crit care trainee and in my junior years, so in your junior years, you're heavily supervised, and that's very necessary because, things can go wrong quite quickly. It's great to have a supervisor there. But I was amazed at how many really impressive cases I was getting. So I was, often on days, so not on the evening shifts because I was junior, and I'd be getting experience with the big cases. And I thought that this was how it was always going to be. What I didn't realize, and I think this is something to take away when you've started training, don't take for granted the amazing array of cases you'll get at the start of training, because once you become independent, especially once you passed your second part exam or your final exam, then you're pretty much able to work independently in most situations, and so you'll be generally doing less of those big cases, and often you'll now be able to work independently doing service lists and being in pre-admission clinic on your own, which is, I think in anesthetics, that is the stuff that we probably don't like as much as the really big cases with all the really, really difficult physiology and pharmacology to manage.
And when you're trying to balance, I guess, the physiological derangements and I guess a patient who's not optimally prepared for surgery as they are for an elective case and stuff. So
there's probably a warning for you when you...
I should really know the last 3 months of the last...
It's all downhill from here. Now tell us about I did the old curriculum, but you're in the new curriculum, and they're very specific about volume of practice and workplace-based assessments. How are you finding that?
Yeah, look, it's really interesting. So we have the training profile system, I think it's called TPS, which is an online system that has all your volume of practice requirements in terms of your surgeries, your procedures, and kind of exposure. So it really guides your training to make sure that you come out as well-rounded as everyone else, that everyone's on the same playing field. And there's lots of assessments. There's workplace-based assessments where you get directly observed on doing procedures. You do mini CXs, which are quite similar to, I guess, what you do in med school, which are really useful. But I think all these...
And these mini CXs, to be specific, they're the ones where you'll do a whole case by yourself, and then you'll be grilled about that case.
Exactly,
Question on your decisions. And I think that's my favorite kind of assessment, really, because that's just like the final exam. But you get practice it throughout, whereas we only started getting practice in a final exam when we were studying for our final exam. So
Yeah,
hopefully you're being grilled on your final exam content right from the start.
Yeah. And they provide just a great framework for feedback and learning as well.
Yeah.
I think there's so much to do that it can become a bit tedious, and it becomes a bit of a chore, particularly when you sit in the primary. You focus everything on passing the challenging exam.
Right. Congratulations, by the way.
Thank you.
For the audience, so it was Kaz's idea to do this podcast, but unfortunately he's been studying for this the part 1 exam, the basic exam, for over 12 months, thanks to COVID. And he's passed, and now he's back on board, ready to hit the ground running
and have a life. Yes.
Yeah, that's right. But keep going.
Yeah, and that's right. So I guess, so a great framework for kind of your training and stuff. I think it's really useful. I think it's a great way to get formalized feedback when you do cases with consultants. I think it's a great way to actually get someone to watch you do procedures that you think you're very competent in. For example, at this point in your second year, you've done so many arterial lines, but it's just one of those things you have to get checked off. And I still learn so much.
There's so many subtle things that you can learn from that. Okay.
Exactly. So I quite enjoy it. I'm trying to get all mine signed off before March next year, so it's a bit of a priority at the moment, but I enjoy it, I think. Yeah.
Oh, sounds good. Okay, so we've covered training. So training is really comprehensive. You go through your whole curriculum over the 5 years and you get exposure to a lot of things. But I've got to say that there's certain things that you will really have to try to manufacture experience for. For example, getting the opportunities to do regional anesthesia can be limited in lots of hospitals. So you've really got to study it on your own, find people who are interested, and look for the cases that you can learn those techniques in a reasonable way, as well as things like thoracic epidurals. Like people aren't doing those as much anymore. Paravertebrals, a lot of people don't get. So really, it seems like it's just regional anesthesia, but also pediatrics. Especially the younger kids. You gotta get enough of those cases, and it's just hard to come by. So I know a lot of our trainees who are really enthusiastic. They'll want to know about any cases that aren't on the roster, emergency cases they can come in and just observe even or help out to get that pediatric time. Yeah.
And I think trauma comes down to that as well. I think when you rotate through different hospitals, you realize how different the case mix actually can be. And I think, so you obviously, had kind of direct trauma experience, but I think there's a lot of trainees who don't specifically have that. And I think it's really nice that you kind of, you're shaped by the experiences that you have in the hospitals you go to. And every time you change, you go somewhere thinking it'll be just the same as your last hospital, and it's just a whole different world, and they're so different in different ways.
I always find that you become an anaesthetist in your niche very quickly. So if you're in a trauma hospital, you become a trauma anaesthetist, but often they're not doing obstetrics and peds, so you kind of lose a lot of that experience in that. But then if you did work in a obstetrics and peds hospital, it doesn't take too long before you learn those skills, because you've got the frameworks and you've got the structures to add on the foundations. And then that's very different to working in a rural setting. So suddenly you've got less resources around, and only a couple of theatres and a couple of staff around, and lots of challenges because of the remoteness. So you become a niche anaesthetist wherever you go.
Yeah, it's a good perspective.
Is then after you've training years, so basic training, advanced training, fellowship, and we'll do a whole section on fellowship at another stage, because it's really where you get to explore whatever you're interested in. And there's different fellowships you can do: airway fellowships, regional fellowships, thoracic, and there's plenty of places around the world. COVID, what would be the word? As long as COVID allows it, that you can go to. And finally, you apply for your consultant jobs. But we'll go through that in another section. And so a lot of the things that we're going to go into in this is stuff that will help juniors who are interested in doing anesthetics. So what did you do in your pre-training years?
Yeah, I mean, this is a question I guess we get asked a lot.
Yes.
I've answered the question about 3 times this week already.
Nice.
It's application season at the moment.
I'll just sit back.
So I guess everyone has a different experience. Fundamentally, I think, we go through the preclinical pathway that we've spoken about before. And I think if you want to get into anesthesia, there's kind of different ways you can. Sorry, can I start that again?
Yeah, of course.
So in terms of what you do in your pre-training, is this really does, there's multiple different pathways you can take. So really what it comes down to is, I think, getting good clinical experience, because in everything you do before anesthesia, it will contribute to your ability to deal with scenarios, and also it'll be the last time you get to do a lot of those rotations. And I think, having time in rotations like cardiology, respiratory, obviously intensive care, but even other ones like endocrinology, those are just invaluable experiences that just form such an integral part of what you do as an anaesthetist. So I think that's really important. And I think also whatever rotation you do, just really doing your best and being really conscientious and hardworking and being very likable, because all that follows you, and they follow you in your references, but also if you stay within a health network, that reputation follows you.
Yeah.
So I know, I think a lot of people, when they do rotations they don't enjoy, they kind of don't turn up on time or don't take it seriously or slack off, and they're very surprised when they apply to their specialty training program and they don't get on. But that reputation just really does follow you.
Because everyone does talk about these things.
Exactly. Yeah. People talk a lot, and not necessarily maliciously, but I think if you don't know someone and a friend of yours who went you into medical school with, who's worked with this person, you ask them their opinion, you will take that on board.
Yeah, absolutely. Yeah. And hospitals and departments are really, really invested in having a good team. I mean, it matters a whole lot who your team is built out of, and any one person that may be a bit of a risk or isn't performing well can have staggering implications for the department. So no one takes it lightly. I think people realize how you're going and your challenges and how you're doing throughout your training, and to really kind of address those and do your best and get along, especially getting along. I think just being able to work in a team, just realize that everyone's trying to do their best, and really appreciating that is useful.
Yeah, and I think everyone's very protective of their department and their specialty, and I think they want to make sure it is I think particularly anesthesia, I think everyone's invested in making sure it's a supportive environment, and it's when you're applying, it's never about your clinical experience. You kind of look over the critical care residents now. Do you care how many CVCs a resident's done, whether it's 5 versus 3?
Yeah, that's true.
Not really, right?
Yeah, it's a lot of the other stuff.
Exactly. It's are they going to be reliable? Are they going to ask you for help? And I think, are they going to be hardworking and contribute and not complain when they have to give someone a break, or not complain when they get pulled from a exciting vascular case to do scopes because the consultant's sick. So
that's interesting. Actually, that was one of the things we were going to go through in the interview, I reckon, which is, if you were the head of a department or you're one of the consultants, what do you want in your trainee? Yeah. And you hit quite a few of the really important things there. So what else do you want to do in your pre-training years?
Yeah, so I think getting involved in the department in various ways is really important. So this can take the form of being involved in audits, research, and also being involved in the department in other ways. So being involved in, I guess, other quality assurance programs, helping out with M&Ms if that's something that's available to you. And I think really becoming someone who wants to contribute. And I think consultants are very good at knowing who's kind of just doing a project to get on the program versus someone who's doing it because they're interested in it.
And even if it is just to get on the program, that's still okay.
Yeah.
At least you're working hard towards an endpoint.
That's true.
I respect the work ethic.
Yeah. As long as you then kind of contribute to that and you don't just vanish.
Yeah, that's right.
At the end of.
I remember every rotation I did, there was just something little that I did, and occasionally it will become something bigger, and maybe it will be published or whatever. But there was always something to do. There's always a presentation or a small audit, maybe some small research thing or some kind of project that you could do or whatever it was. I remember there was always something. So at the end of 2 years or even 3 years, someone who's done something very slowly, it shows compared to someone who's done nothing. So nothing needs to be big, and big projects come out of very small little gains and small little connections with people.
So other than kind of the line in the CV that you get from doing those projects, what is it that tells you about a candidate when they've done all that stuff or when they want to do that stuff?
I mean, it's really just enthusiasm. I love people that are self-starters. There's a lot of things that are very easy to do, and we'll probably get to this in the CV. But if something takes a lot of work and initiative, I really respect that. For example, paying money to go on a one-day course, yeah, great, anyone can do that. Paying money to go on a course, then becoming an instructor of that course, or making your own course, that's the next level of interest and enthusiasm and initiative and intelligence. So I think those things really matter to me. And also, if someone's done something that seems buffed up, it's very easy to tell. So I don't rate that highly either. And maybe we've all done that, but I think most people can see through what's real and what's not.
Exactly. And it becomes really apparent in the interview, because there's often a question dedicated to your CV. And if you fluff something there and you get caught out doing the interview, that looks really bad.
Exactly.
And I think the underlying thing with all this stuff is really you wanna stand out in some way, and you don't have to do a PhD, you don't have to be phenomenal. I think you just want you to be someone who's unique, because realistically everyone applying for these jobs are pretty great. Like it is the cream of the crop of the residents who apply for these jobs.
And I think it is almost a sad thing that there's maybe a few job places, but quite a few people would do very well in the job, and it's just one of those things that there's just not enough training positions. But one of the other things that I remember someone saying was, going through med school and going through your kind of junior years, you're very, I guess, department or clinical focused. But then there's a whole world outside of this. So, getting involved with things like the medical boards in the hospital, or the AMA or the ASA, or whatever you're interested in, having just an interest in how the hospital runs, because there's lots of there's definitely need for junior staff on various committees, and I think that's a really easy thing to do, and helps you learn how things work.
And I think also something that's sometimes forgotten is you still need to have a life outside of all this stuff. And I think
that's ridiculous.
No one told me.
No one told me that. Life is podcasting, education, and anesthesia. Balance.
I just bought a bike, so riding as well.
That's right.
I remember I've heard these stories from successful candidates for their quick care jobs, where half of the interview was talking about their dog, or the fact that they make beer. That they brew their own beer, and they're standouts, because I think for the interviews, if you think about it, everyone's competent, everyone's good, and the next level is, are you reasonable and safe, and the next level is, are you exceptional in some way, and that still narrows it down to about 20 people.
That's right.
And then how do you pick 3 from that, and really you go, well, who's interesting, who's someone that I can have a conversation with, who's someone that I think would be supportive of those around me. So I think if you have an interest, I still think it plays well to your chances to continue that.
So I think that's good. So I think that's pretty much coming up to about 30 minutes or so. Look, something that we will talk about continuously through this is the fact that the ANZCA attributes of an anaesthetist are medical expert, communicator, collaborator, leader and manager, health advocate, scholar, and professional. I think these are certain things that will come up time and time again when you think about what do you need to do, even in the preclinical years. Show on your CV the way you think about what you want to be at the end of your anesthetic training and onwards. I think that's quite useful. So I think that's a pretty good summary. I think, pretty much we've gone through the ANZCA pathway. You've got your general training, you apply for anesthetics. It's a pretty comprehensive application with CV, cover letter, application form, references, and an interview if you get shortlisted. And then we've gone through what the 5 years of training would be like, and a bit of experience about that. But we'll go through a lot of these things in more detail in upcoming episodes. Excellent.
Fantastic.
Excellent. So thanks very much for listening and watching, and this is ABC's Anesthesia, so please share with anyone who might be interested, and we'll see you for the next episode.
Sounds good. See you then.
Cool.